welcome to News9 Digital. I'm Pratibha. Thank you for joining me live. And today I'm going to talk about something that we all should be aware of. Today is the World's Arthritis Day. And, you know, there are some scary statistics that are out there that will tell you why we should have more awareness about it and what we can do to stay much fitter and avoid it completely. So in the next decade or so, arthritis, especially the knee arthritis, is expected to emerge as the fourth most common cause of physical disability in India. It affects about 180 million Indians, and there is an increase in the numbers over the past few years as well. So its prevalence is higher than many of the well-known diseases as well, such as diabetes, AIDS, and even cancer. So much so that doctors, experts, fear that our healthcare system could be overburdened by the increasing number in the coming years, and it's an epidemic that we should all be worried about. Now, there are various factors for it, including a lifestyle that depends on the over-dependence on knees. That's something that we should be careful of. But what are the factors that we should be aware of? What are the changes that we should bring into our lifestyle to ensure that we do not get arthritis? And does it affect men more than women? Does age play a factor as well? These are some of the questions that we will be addressing today. And to address these questions, joining me live is Dr. Nagraj, a rheumatologist. Many thanks for joining us, Dr. Nagraj. The statistics are quite scary. There are crores of Indians who are suffering from arthritis. It's much more in India than it is in the Western countries. So what are the factors that affect us? And for those who don't know, what are the symptoms that we should be wary of?
Good morning. Thank you for calling, Mr. Pratibha. Yeah, today is World Arthritis Day, and it is said that about one out of every 5 Indian adults is said to be having some form of arthritis. And you rightly mentioned, knee arthritis is well known. That is called as osteoarthritis. It affects mainly in aged people above 50.
Okay.
And but we are actually more concerned about arthritis which affects young individuals. You can see children with arthritis. We have many young adults in their 20s. We have many young adults in their teenagers. They have got arthritis, and sometimes that can be very crippling and disabling.
Okay.
You mentioned about this being the 5th common disability, but already so far as the young adults are concerned, it is number one condition which can cause disability worldwide. It is WHO statistics. It is the number one disabling condition.
Okay.
So talk about 3 common rheumatological disorders are this rheumatoid arthritis, lupus, gout, psoriatic arthritis, this back pain, spondylitis. All of them can be a form of arthritis.
Okay.
And yes,
in fact, you know, Doctor, the common misconception, the common misconception is that it affects only the older people. So what you're saying is that even the younger people should be aware of what it is and should avoid it. But what are the factors that are really leading to it?
It is said to be a multiple combination of factors, not exactly one single factor. It is said to be a combination of infections, environment, and even sometimes this viral infections like chikungunya, dengue, or now we have COVID like that. Or we can attribute them to even genetic factors. There are some types of arthritis which run in families, and there are factors attributed to the food. For example, uric acid-rich foods can lead to a condition called as gout. So it is a multiple combination of factors in various proportions which lead to. It is similar to other chronic disorders like hypertension or diabetes, but not a single factor is well known. And as you mentioned, even overweight is one of the important reasons. We can see overweight leading to early onset of knee osteoarthritis, etc.
Okay. Okay. Also, you know, studies show that women are more affected than men, and not just that, they also get affected much earlier in age as well. Why is that?
Yes. For out of every 4 patients, they say 3 patients are women and 1 is a male patient. This is particularly so in arthritis which affects in younger individuals, as I was talking about earlier. In younger individuals, probably hormones could be one of the reasons, because before women get their menopause, they are more prone to get arthritis. And believe me, arthritis means, when we say not just joint pains, joint swelling, joint stiffness, yes, they are the classical symptoms. These joint pains, joint swelling, joint stiffness in the morning hours especially, stiffness of the back pain which affects in the mornings, which can disturb the sleep, which can cause a lot of difficulty in even holding a cup of coffee in the morning. All these things are very well known. Most of our patients are aware of these things. But it is not just about these the arthritis conditions affecting the joints and bones. It is more so, it can affect other areas such as eyes. It can cause redness of the eyes, it can affect lungs, it can affect heart, it can affect kidneys, it can affect skin. For example, I was talking about psoriasis. So we should be aware that such patients can be prone to involvement of other organs in the form of internal organs as well as external organs, which are called as extra-articular features. They are very important. Probably the reason why we say it's more common in women, especially premenopausal women, is it can be related to hormonal variation. Women are particularly more to develop arthritis-related conditions when there is a major variation in the hormones. For example, like in pregnancy, abortion, around the time of menopause. These are the times when they actually develop an onset of an arthritis.
Okay, all right. And also, doctor, can you say that there is a cure for arthritis really, or do the medicines only ensure that, you're relieved of the pain? And for those who want to avoid it, what are the precautions that we can take, perhaps a change in lifestyle?
Yes, ma'am. Arthritis is predominantly a treatable condition, very well controllable condition. But when it comes to, when you talk of cure, not many arthritis conditions have a cure. Most of them can be very well controlled with good medicines without much side effect. In fact, that's the reason every year when we celebrate, when we observe this World Arthritis Day on 12th October, in fact, the previous year's theme was what is called as don't delay, connect today. That means you should not delay your symptoms. These are all, people consider them as minor symptoms. Unless the pain is very severe, unless the shoulder is very difficult to move about and reach to a height, the patient will not go and seek a medical condition. So today's theme, this year's theme is, it's called, it is in your hands, take action. After someone says, Lakshmi, that is the kind of message the World Arthritis Federation is given this year. So it is, first thing is not to delay the seeking of medical care, appropriately approach the right person, medical person, that is the rheumatologist, and seek medical attention early as possible. Do not delay it for months or years. There have been delayed, the incidence of years of delay. The second thing is having a good lifestyle, like maintenance of good body weight and take good nutrition. The third thing is you should not be scared about medicine. Because the ultimate result of this disorder is going to be disability, and by fearing the unnecessary fear about the adverse effects of medicines will drive many patients away from the correct treatment. So they resort to short-term remedies, they go to alternative therapies, and they try to treat themselves at home. These are all more riskier and can be more dangerous than actually going through and taking advice from the right specialist.
Okay, all right. Well, Dr. Nagaraj, many thanks for joining us live with the information that could help us all. So, of course, early detection is half the battle won. And as the doctor said, it's best that we are aware that if we have any symptoms, immediately go contact a doctor. And especially in times like these, when we are facing the pandemic, there are many people who try avoiding going to the hospitals completely. For them, of course, there are online consultations that are available. If you are feeling any symptoms, it's best to consult a doctor and get a cure for it. And if not, of course, to also maintain a fit lifestyle to ensure you never get it. Well, that's all I have for you today. Thank you so much for watching me. I look forward to your comments on the subject. Take care and stay at home as much as you can.